Hi, viewers. Welcome once again to the Let's Talk Health. Today, I'm pleased again to come your way with a very important topic related to our health. You know, some people say, and well, it's debatable that the cheapest commodity now is sex because wherever you go, you walk on the street, everybody's just having sex. Imagine if we're not to be having diseases, what would have happened? So today we're going to delve into STDs, sexually transmitted diseases. My name is PIUS and I'll be your host for these segments once again. And to help us digest this topic is no other person but our own Dr. Victor Loglo.
Thank you.
You're welcome.
Thank you.
It's nice seeing you once again.
Yeah, same here.
How
It's
has
always
life?
a pleasure.
Yeah. I always like it when you say it. It's always a pleasure to be here,
Yes.
making medical. You just give me the lines again.
No, but it's
Oh, I like that line.
it's always a pleasure. To be here.
Making medical knowledge
Yes.
simple.
Simple
Uh-huh.
and accessible to the general public.
That's
without
beautiful.
going to a medical school.
Charlie, I love that line. Today, we want to delve into ST. You know, I'm even confused. I've been hearing XTIs, STD.
Yes.
First of all, what can you draw the thin line between
difference.
STDs and STIs before we delve into it more?
Someone would say it's simple. One has a D, one has an I.
Yes, we all know that. Anyway,
Sorry, yeah, one has a D, one has an I. So yeah, so the difference is actually in the D and the I. The sexually transmitted disease, okay, it results from a sexually transmitted infection. What do I mean by that?
okay.
Sexually transmitted infection is the introduction of the infectant or the biological agent, whether it's a virus or it's a bacteria, as a result of sexual intercourse into the body. Once it's introduced into your body, you have become infected with it.
Okay.
But once you start showing the clinical manifestation of maybe painful sexual intercourse, painful urination, a discharge, or anything of that sort, it now becomes a disease because you are now showing the clinical symptoms.
Okay.
So somebody can have a sexually transmitted infection, which may not necessarily end up showing. There are people walking around with some STIs, like herpes infection. They're having an infection, but it's not showing. But the day they start to have genital what and things, it has become a sexually transmitted disease. So that's the difference between an STI and STD.
Oh, okay.
So
Okay.
to start with, STD is any form of disease. STI is any form of infection
Okay.
gotten as a result of a sexual intercourse.
So they are like brothers and sisters.
Yes.
Okay.
So the I is when the person gets
get
the infection. Somebody can have the infection,
but will not
may not be manifesting or showing the clinical signs.
Oh, okay.
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 The moment you start showing it, there is an increased risk of transmissibility. However, there are people who are infected and can still transmit, but they are not yet showing it.
Okay.
So there may be people who may be having the infection and it has reached its, infectious stage. Okay, so we have different stages. We have the incubation, we have the infectious stage.
No, before we get to that, the stages of it, let's now get what are the classifications of these STIs or STDs? How many classifications do we have?
So in this case, we call them, we'll say examples or types of STIs that we have instead of classifications.
Okay, examples and types.
So we have examples such as HIV.
You don't just call HIV. You say the almighty
The
HIV.
almighty.
Yeah.
The almighty. You see, I'm sorry for underrating HIV like that. It's also because of the progress we've made. We've made a huge progress.
That's great.
We've made a huge progress. Now, as we progress, you will come to realize another STI that is even much more dangerous than HIV in terms of the prevalence in Ghana. But we overlook at it. Oh, nowadays, medication and things have improved HIV, that you can see somebody, back in the days in the 90s, when you see someone lanky, chengelenge, emaciated, look, has lost weight. You can
With
see the
some
bone
rashes
rashes. Like, hey, this person. Nowadays, you can see all like good-looking people,
You see the
and
stigma attached to it. That's
maybe
what has
unassuming.
really done a lot of
Yeah,
harm
yeah,
to it.
yeah, yeah. So yes, HIV, almighty HIV, but you come to know another almighty as we
Okay,
progress.
so HIV, yes.
HIV, chlamydia,
Mm,
gonorrhea,
mm,
syphilis,
mm-hmm.
hepatitis B and C. Yeah, we have different type of hepatitis, but hepatitis B and C is a suspect when it comes to sexually transmitted infection. So Hep B and C, herpes, okay, herpes, and then genital warts.
Interestingly, all the things you're mentioning, it is only gonorrhea and syphilis that we keep hearing on the
Yeah,
street. Gono,
true.
gono, gono, gono.
Yeah.
So that is
small
all
thing
we
now,
know.
hey, I think the girl has given me gono. My friend, when we break it down, you will realize that even chlamydia is mostly asymptomatic. That word is here. It's mostly asymptomatic. But chlamydia can be on a person and there will be no signs.
I'm just even lost because I don't
Chlamydia.
even know the forms. Please, whilst you are mentioning the types, if you can
Break it down.
take the forms they take,
They take.
that one can just and see and be like, okay, I'm suspecting this,
Okay. So
that
where do
I
we
need
start
to go
from?
to the
HIV?
hospital. HIV, we all know, but just throw light on that
Okay.
again.
So yes, I'll do like I'll give a summary of all small.
Yes,
So
yes,
HIV, currently the prevalence in Ghana as at last year was between 1.6 to 1.9%. What it means that when you count every 100 people, 1.6, we cannot have a 0.6 of a human
So
being. So
roughly
let's say
two.
2 out of 100 has HIV.
Okay.
Now let me do this mind blowing thing here before I get there.
Okay.
On the other hand, when you take hepatitis B, out of every 100, about 8 to 14
What?
has hepatitis B.
You are kidding me?
Yeah.
Hep.
Yeah, Hep B. Hep
Whoa.
B. Yeah. So that is why we are afraid of HIV. Have you thought of Hep B?
No, that's Hep B also kill.
Hep B does. You know what Hep B does? Hep B causes liver abnormality. Okay, I don't want to. So the right word is liver cirrhosis, which can further develop into liver cancer. This liver cancer, you have a few years to die if you have liver cancer. So you see a young man, the abdomen is already swollen like a pregnant man. It's all water. Every time they have to go to the hospital for a tapping, they'll kind of tap with a needle somewhere and drain some of the water. Immediately it's done, the water needs to be filled again. It can happen in both in men and in women. This woman is always pregnant. He's not giving birth. That, yeah, this is what Hep B can cause, causing all the jaundice in the eyes, itching. Hepatitis B is a bad disease, so that is how prevalent it is. So hepatitis B, HIV, I said is 1.6 to 1.9. So out of every 100. So that's what is happening. And the other thing about HIV is that the spread depends. So HIV, this now about to say cut across all the viral diseases.
Okay.
So in this case, HIV, hepatitis B, hepatitis C, herpes, okay, and then human papilloma virus, HPV.
HPV, yeah.
They are all virus. In the viral conditions, so these are virus. Then the bacterial ones are the chlamydia, gonorrhea.
So there are two
syphilis.
causative agents for
in this case,
sexually transmitted diseases.
So viral
and then the
and
bacteria,
syphilis.
and then the bacteria.
Yes, and the bacteria. Sorry, viral and then the bacteria.
Okay.
Now there is a there is a reproductive tract infection, which is not a sexually transmitted disease. However, many people mistaking it for a sexually transmitted disease. This is RTI and not STI, reproductive tract infection. Vaginal candidiasis. So she has given me white. Oh, my husband has given me after he traveled after a long trip and he came home, doctor. I've started having a whitish discharge and things. No, it cannot be given through sexually, or it cannot be given through
sexual intercourse.
Yeah, intercourse.
But my friend was still. I was talking to a friend. He's married. He said So you see, when your wife has white and then they are treating it, you have to go and treat it.
Yeah. So today we now understand it is not an STI.
So it cannot be. Hey.
The sexual intercourse can change the epithelial lining of the vagina, change the environment, the pH, and increase the risk of the woman having white. However, it was not from you. You didn't transmit a candida into her.
No, she
you
got her
rather
own thing.
increase her candida, which was already existing as a normal organism.
Okay.
Chlamydia is a normal organism there. It has a normal number there. But the number can increase depending on the change in the pH in the vagina.
So she has her own thing.
Can cause it.
She has her own thing.
Yeah, so it was not that the man introduced the candida there.
Okay.
So it's a reproductive tract infection and not a sexually transmitted
disease. So you were we were touching on
the viral ones. So the viral ones, the mode of transmission, okay? The mode of transmission, yes, even though we are talking about sexually transmitted infection, the viral load in a body, okay, can be transmitted through body fluids. Virus can be transmitted through body fluids. And the fluid can be considered as very low means of transmission, moderate or high.
Okay.
Fluids within which we will say that, oh, the viral load may be very low, includes tear, saliva.
So there could be the
sweat.
viral load in it, but it's
yes, it's very low.
Okay.
Tear, saliva, urine. Okay, urine. So tear, saliva, urine. It's very, very low in them. The ones that are moderate, anal secretions.
Ah.
Yes.
You secrete something from anus?
Oh yes, of course. We'll now come and talk about why men who sleep with men or women who sleep with women, especially men who sleep with men, have a higher risk of having HIV. And women have higher risk than men. 2 times the risk of men in having HIV. So yes, we said the moderate is anal. The more higher concentrated fluid, semen, vagina
discharge
fluid,
vaginal fluid, yes,
fluid.
that's the right word.
Semen, vaginal fluid, and breast milk. Yeah, so those who like, as part of the romance before they start, something small comes. If the person is infected with any viral, disease, there is a higher concentrate of the virus in the breast milk.
Oh, okay. So we are still talking about some of the appearances of these STDs. Yes. So we spoke about HIV. We know the rashes. That is even at the stage before
at the later stage
before you can see that.
So what increases the risk, through sex, is when there is a break, okay, in the continuity of the skin. So either in the vagina or on the penis, okay. And the reason why women are at greater risk is because they have more opened body surface area compared to the surface of the penis that is exposed. It's just the opening, the meatus of the penis that is exposed.
It's called what?
Meatus, meatus.
It sounds like something. Meatus.
Oh my God, you guys. Yeah. But that's the name. This is meatus. Yeah.
Oh, okay. Yeah. That's the opening.
Yes.
No, I'm still trying to talk
about. But when you look at the vagina, during the whole intercourse, during the thrusting in and out,
you are entering.
Yes, it has a bigger mucosa membrane compared to the man's own. That is the tip that is exposed. But the woman, the whole surface area there is bigger than the smaller one that is open.
Yes.
And there is more virus in the semen compared to, yes, the viral load in a semen is higher than the one in vaginal lubricant. So it means that if a man who is infected releases the woman has a higher chance of getting infected than the woman who had it, giving it back to a man.
Okay.
Are you getting it?
I get you.
Yeah, that is very, very simple as that.
I think
if the woman had it, the risk of giving it to a man is lesser than if a man had it.
Okay. So we'll be delving into HIV as a full topic on its own subsequently.
Yeah. So when you move on to the rest, hepatitis B, Hep C, yes, I've made mention of it being transferred through body fluids.
Yes.
Okay. So sweat.
How does Hep C looks like?
So they both have a similar thing, but the Hep B is more common. The Hep C yes, you see the jaundice, you will have the abdominal swelling, which or distension. And this distension, as I say, is as a result of fluid accumulation over there. There is a function that the liver is supposed to do. It's supposed to produce a certain substance called albumin. Same albumin we find in the egg. Yes. Oh, as part of the management, we tell them to take a lot of albumin because albumin is an important thing.
What is the albumin? How does it look like?
It's a protein. No, I mean in egg, we have the yolk and we have the albumin. Yes.
The white side.
The white side.
It's called what?
It's albumin. It contains albumin.
It contains albumin.
Exactly.
So just okay. So when we get to the management, to talk about that.
Exactly. So this albumin is responsible for holding fluid into the blood vessel.
Okay.
So the fluid will not go out.
Okay.
And this is a function of the liver. There are about like 10 functions of the liver.
Okay.
One of it that will be affected will be the albumin production. So it goes low. So it means that there will be nothing to now because pulling water back into the blood vessel. Okay. So the water will start going out. The cameras must feel the abdomen.
Oh, okay.
Over that. So they have that. You see, a young man. And it's deadly. It's
very deadly.
Very deadly. So
so let's go to gonorrhea. How does it surface?
Okay, so
how does it?
But we are not done with the viral ones.
Okay.
HPV.
Yes.
Causes cervical cancer. Okay.
I read a little about HPV and I realized that they said there are categorizations of it. They says a particular one that causes cancer. There's one that causes just the formation of that what on the skin.
Yes. Yes. So it's worth noting. So the one I'm talking about, I'm sure you're talking about herpes. So we have herpes type 1 and type 2.
The herpes is a new word to me today.
Oh, okay. Herpes simplex. So have you seen, the development of blisters? Somebody
yes. I've heard herpes before.
So
now just waking up.
That one is herpes simplex. Okay, that's the type 1.
It's like blisters.
Blisters, yes. That it normally occur during childhood. You have the blisters around the mouth, around the nose, and all. That's the type 1.
It's also HPV.
No, HPV is also different. They are all HH, but they are two different things, and they can be transmitted through infection, especially the herpes type 2. That is the one that will result in the genital warts. That results in genital warts. So genital wart is different from cervical cancer. That's why I want you to understand before we break into that. Genital warts are growth that may be found on the penis. Okay, it can be found on the skin. If it's the vagina, it will be found at the vulva area. Okay, and it can be big, it can be spreading, it can be very, very extensive. Okay, but when it comes to the human papilloma virus, it happens on the cervix. It will cause cervical cancer.
Then what of in men?
Oh, so in men, there may also be cancer, both in men and in women. But it's more common in women. Now, in women, one thing that puts women at a higher risk. So, like I said, it can become an infection, just having the human papilloma virus infection. But for it to develop into the cancer, the disease, there are certain things that may increase the risk. One is a woman with multiple sexual partners.
Wait, I want to draw a thin line between the herpes and the HPV.
Okay.
So, that which the herpes, you said there's type 1 and type 2.
Yes.
The type 1 comes in the forms of blisters.
Yes.
At the genitals.
No, around the mouth.
Yes.
Around the mouth.
No. You have herpes and then the sign is on your mouth.
Yes.
That you had sex.
No, so
you had a sexual
so this one is transmitted through body fluids. It's transmitted through tears, nasal drop. So a person who has an infection, like a child, the child sneeze, and then you smell, you pick in the droplets. It will reflect. It will manifest in the form of the blisters around the mouth. So
it's a viral infection.
Yes, that one is not through sex. It's through the tears or the nasal droplets in the air.
So,
but the type 2 is through sex.
The type 2 is through sex.
Yes.
And the type 2 is what forms at the genital.
Yes, genital as growth.
As growth.
So there will be excessive growth. It will start something small and keeps becoming bigger.
And that's what's called a what?
And bigger. Yes, that's genital what.
So,
But when it comes to the human papilloma virus, it will result in the cervix. You see, the cervix that is inside there becoming cancerous. So remember, one is at the outside, the vulva. The vulva becoming growing extra growth on it.
Okay.
So forming the what?
Okay.
But the other one is in the inside.
The HPV is in the inside, but the herpes is the one outside.
Exactly.
Oh.
Isn't it not clearer now?
Yes, it's clear. It's clear. It's clear. It's clear. So are we done with the virals?
Sort of. But when we move into the bacteria side, when you take gonorrhea like this, gonorrhea, it manifests in the form of abnormal discharge. The discharge can be a whitish discharge on both sides, male or female. Okay, it can be whitish, it can be yellowish, it can be greenish.
Green?
Yes, mostly it's yellowish green.
Oh, you
yellowish
me.
Green, yes.
Yellowish green.
Yes, or yellowish or whitish. Yes.
Green. Where is the green coming from in the system?
So that's the thing, and there may be painful urination on both sides, male and female. Painful urination, painful sexual intercourse as well. Maybe painful sexual intercourse, and this is because after it ascends into the uterus and the rest, during the sexual intercourse, there is a touch of the penis. Whenever it touches the cervix, it shakes the whole thing at the top there. So there is more low abdominal pain, and this cuts across most of sexually transmitted infection. Everything you said here cuts across it.
Okay.
So yes, some may also have anal pain. Those who got it through anal sex.
Okay.
Yeah, some may have.
So you can have gonorrhea in your anus.
Yes, as well. You can even have it in your throat.
No, I'm just everything's sounding so green to me, as if I've never heard about STDs
No.
before.
That one is one of the most well documented, complications of oral sex.
Gonorrhea in your throat.
Yes.
So,
You can even have in your throat.
So what of syphilis?
Syphilis is also, and syphilis has stages. Okay, it has like 4 initial stages, even asymptomatic. Like you will not see any signs.
Okay.
But it's something that's happening inside.
Okay.
There may be sores, blisters around the penis or around the vagina, which is non-painful. Yeah, it's not painful. It will be going and coming, healing and coming. Then that will progress. It at the latter stage, it disfigures the body. Okay, syphilis is a bad disease. Syphilis, when it happens in a pregnant woman, it can cause birth abnormally. It can cause premature delivery, so preterm delivery. It can also cause stillbirth. The gonorrhea, before I go, the gonorrhea can be passed on to the child, right, during the delivery process. It can affect the eyes of the child. And the reason why we give eye drops to the baby. You're like, when it's a newborn, why? Yeah, because if the mother had gonorrhea, had chlamydia, it can be passed straight. The child will have infection to the eyes.
Gonorrhea is affecting eye?
Yes, in a newborn.
Eesh. So you mentioned chlamydia too. So
chlamydia, yes. Chlamydia, as I said, is a stubborn one. It can be hidden for so long and you'll not even know that you had it. But in the later stages, when it becomes a disease, when it starts to show the signs, you see all these things we've made mention of: difficulty in urinating, the abnormal discharge, painful sexual intercourse. Okay, some may have rectal
dysfunction,
pain as well.
Pain.
Yeah, rectal. It's not erector.
Okay.
Rectal.
Okay.
Now,
yes.
The bacterial ones, they also present with chronic pelvic pain. So small time, they are having pelvic pain. Small time. This is unrelated to their menses.
Okay.
Yeah. So a woman that is having chronic pelvic pain all the time, unexplained pelvic pain, you need to get investigated for sexually transmitted infections.
I mean, everything is sounding so new to me.
Yeah.
Okay, so quickly, let's look at the stages of the sexual transmission. How you speaking, it appears that each of them might have different stages.
Each one, and they say, so it depends on what you are having. Okay, but in simple terms, one is first starts with the exposure. Okay. First there must be an intercourse.
Mm-hmm.
It's more riskier in a person with multiple sexual partners. However, there can be one person who even had just one partner and can still take it from that one partner.
Oh, obviously, when the partner has it.
Or when the partner took it from another person before coming to see you.
Definitely, he has it before
You
he
get
came.
so the exposure is the first thing. Then it will introduce it to you. But depending on the person's immune strength,
Okay.
the immune system, how strong? Because if the immune system is very strong, it's able to fight it off. But if it's not strong, that is when it introduces other things in. So, for instance, the syphilis.
Yes.
We said the syphilis will have a non-painful ulcers around the genital area. This non-painful ulcers has open way for the blood vessels to attract any nearby infection. Anytime during sexual intercourse there is any form of bruises or any cuts anywhere, it opens the person to a lot. It opens the person to a lot, including HIV. So yes, the initial exposure, then if your immune system is stronger, it will be able to fight it. If it's not stronger, it will now take it in, infect, cause the changes in the body, and later it will start to manifest. So these are the stages. The manifestation is what we made mention of. Okay. It could be the dysuria, that's the painful urination. It could be pain in sex, it could be the discharge. And the discharge can go a long way to ascend upward and then cause the pelvic inflammatory disease or cause other issues in the man as well. Oh. So those are the stages in sexual transmitted infection.
Okay, there are two things I want to ask. First one, we've been hearing that it is quite okay. Women tend to pick the sicknesses easier, as you have said.
Yeah.
Something baffles me. You see the tip of a man's penis.
Yeah.
How is the disease getting in there? That's my first question. It baffles me. Because
I
see it's just something small.
Yeah.
And then at the end of the day, a man says infected, but you are discharging. Yes. I mean, it's coming out. So if there's anything at the entrance, you should brush it out. How come you're getting it in?
Yes. So normally, that small opening still comes into contact with vaginal fluids. So anywhere there is a mucosal lining, so on your eyes, there is a lining on top of the eye. The lips, the lips, throughout the mouth, there's a lining. And under it is a blood vessel. It's very thin.
Okay.
It's the same as the vagina. It's the same as in the urethra.
Okay.
Okay, the urethra is the inner lining of the passageway, the hole through which the urine and then the sperm comes. Okay. So that's the reddish part we see. The outer part is dark or fair or chocolate, depending on
your complexion.
Depending on your complexion. Yeah, but the red is the pinkish part. The pinkish part.
Yeah, the tip.
That's. So that part still comes into contact with, the vaginal fluid.
Just that small.
Just that small part. However, a bruise, which may be developed during the process of the thrusting, or it might have pre-existed before, exposes you even higher. So it's the reason why in the management you will hear the use of condoms or barriers, so that your skin does not even come into contact with the other membrane at all.
Okay.
Because there's already a broken skin or a broken membrane, so you're exposed.
You in your earlier submission, you also spoke about why the homosexuals tend to get. Yes. Because you're saying there is some kind of.
It's the same explanation. See, if the vagina is said to have a higher total body surface area exposed to the smaller part of the penis, the same way the anus will have a higher pinkish part exposed. So a release into this part, straight away, it just goes through the first layer and into the blood vessel. Straight. You get it now?
Yes, I'm getting it now.
So that is why some of the risk factors, aside, having a multiple sexual partners, unprotected sex, men sleeping with men, there's also a risk factor over there. People who use drugs and alcohol, they tend to have more of risky behavior, because they are not of themselves. So they do more risky sexual behavior, and that may result in that.
Wow.
Yeah.
Okay, so Doc, I don't want us to belabor this so much. So quickly, let us see talk about the management,
Great.
and then we can wrap it up there.
Great. So, the management is very, very simple. If you follow the discussion, you realize that there are some key things when it comes to preventing sexually transmitted infection. Just understand that the moment you agree to sleep with someone, you have signed up to like it's a huge risk. You can sell your whole lifetime in that one sexual intercourse. Or yes, no, I mean sex is not just forget about all the. I'm not saying forget, like, but all the spiritual and moral things that is being set aside, health wise, any one sexual intercourse, you put your whole life.
It's enough to put your
you
life
put
into
your
danger.
whole life into danger. So
just one round,
unprotected sexual intercourse. So the first thing is protection. Protection.
When we were young, when a condom advert started, say use condom, tra la la.
The ABC, abstain.
Yes, be faithful and use condom.
So the first thing I'm starting is from the C. You use condom.
Why won't you start from A? Because that's how we were taught in school. A,
of
B,
course,
C, D.
but research has shown that it's so hard, even for their father. It's so hard to abstain.
I never heard anything. Anyway, so let's start from the C.
Yeah, so condom or protection is very important in any way. So condom use is very, very, very important. Number two.
Wait, the condom. Let's delve into that because now that we are having, you spoke about gonorrhea in the throat. Yes. How are you going to use condom for the mouth?
Okay, now interestingly, technology has so advanced that now they've even introduced tongue barriers. Something you can wear on the tongue.
No, if you wear it on the tongue and you used to lick. Now all the other parts of the mouth, why? And they, I mean,
remember we said that the ones through saliva is minimal. It's a low concentration, of the viral load.
Okay.
Yeah, so at least it's minimal compared to the semen and.
But it's my penis that is entering your throat.
Yes.
Yeah, baby.
Yeah, so
BJ is out of line now.
Yes, exactly. But I mean, when we continue, you understand circumstances under which it may be safer.
Okay, so let's
proceed. This is a circumstance. If you have a mutually monogamous relationship.
It's just you, one man, one woman.
Yes.
There's no extra party.
Yes.
No dog anywhere.
Yes.
No side cock, no side chick.
Yes.
Nothing.
Yes.
One
Which
man, one woman.
Which appears to be, it's becoming a very difficult thing nowadays, but that is not my job to explain why. But if you can.
In other words, you're saying that it becomes quite impossible.
But I cannot substantiate what I'm saying.
Please, pastors are watching. They have only just one wife. I'm not. Don't go there. Let's continue.
Yeah, thank you.
Let's continue.
So yes, if you can have a mutually monogamous relationship,
okay.
Sometimes one party could be the faithful one, but the other party is going about sleeping here and here and here. You pick it
and bring it.
That is when you put in your mouth. If you were all staying faithful, it's okay to have your aura. So, and it's even more worse if both parties are playing away and then coming back home.
I wanted to mention a name, but I'll keep quiet.
Hey!
It's a common one, and it has become an issue these days. Boys who just, if you don't know, then you don't know. You know that thing. Okay.
Oh, yes. So, yes, so it's important to stick to one sexual partner. And then number two, get regular screening. The moment you know that you are sexually active, get regular screening for sexually transmitted infections. Okay. Like chlamydia, gonorrhea. Once in a while, go and get screened for it and get it treated. Because chlamydia, especially like I said, is asymptomatic. You may be having it, you may never know that you have it.
Is it treatable?
It's treatable.
It's bacteria.
Chlamydia is treatable. Gonorrhea is treatable. Syphilis is treatable. HIV is manageable.
It's manageable.
Hep B is incurable.
Incurable.
Yes, it's manageable.
It's manageable.
Yeah, but Hep C is curable.
Oh.
Yes, Hep C has a medication given, and then that's it. It's gone. It's curable. But Hep B, the one that out of every 100, about 8 to 14 people may be having it in Ghana here, is incurable.
So there is some they've been giving some jobs for
Yes.
the
So that is part of the management.
oh, okay.
Get vaccinated. Vaccinated for both Hep B and then human papillomavirus in young girls
Okay.
to prevent the cervical cancer in their early age, around 21, when they become sexually active.
You saying 21? Doc, it appears you don't
Nowadays,
step on the streets. 14,
Yeah.
13. Oh, Doc, you should know better now.
I know.
Uh-huh.
I know. So the advice is that they need to get the vaccination, okay, and that helps to.
Can that be got at the hospital?
Yeah, it can be done at the
The
hospital.
HPV and then the hepatitis B.
Vaccination.
You
be
can
done
get
at
the
hospital.
vaccination.
Yes,
So only
the
these
hospital.
two have
Vaccines.
vaccines.
Yes, for now.
But the rest,
We don't have
you're on your
vaccines for
own.
it, yes. Herpes is incurable. Human papillomavirus is also incurable. So it's the earlier you know, the better. Once you get it, you are living with it. Remember, even when it comes to the bacteria ones, the chlamydia and all that, can result in chronic PID that may cause a lifelong problem, like infertility, ectopic, chronic pelvic pain. A woman in her whole life is going to always be having chronic pelvic pain as a result of the adhesions that has happened. Somebody has like what we call frozen pelvis. So he's enduring the pain almost every time. Every sexual intercourse.
This thing sounds so scary.
Yeah. So that is why once in a while you need to go and get treated.
You get checked.
Get checked and then, treated.
Wow.
So these are the management. So I've made almost all the ABC. If you can abstain, abstain. But if you want to,
no, the abstain, you just said it in the past. If you can abstain, then that's all. No, talk about abstinence.
No, I mean,
so we should all like become seminarians, and
if we can. But I know that it is close to impossible. It's close to impossible, especially in these times when we have our hormones dangling and all the beautiful things and
my God.
Yeah. So
it's quite.
If you can, but if not, stay faithful. Both of you, both parties, stay faithful. If not, reduce the partners. Use condom. Get tested.
No, you say treated. Reduce the partners. So that one, that obviously people will be keeping more than one.
Yes, if you can.
Anyway, so any last comment for our viewers?
So, sex, even though it's pleasurable, it can be risky. So if you are doing, be responsible. Thank you.
Thank you to Doc. It's been a pleasure having you, and we appreciate your time with us here every day. You, as you always been saying, to make medical knowledge easy and accessible. Through this medium, some of us have learned a lot personally. And now when I talk, you think I'm a medical student. Meanwhile, I don't know.
Without going to any medical school.
Yeah.
That's what we stand for.
Yeah.
We make it very simple.
So, you see, I've been calling myself general, and I say I'm the only general who has not been to the military academy.
Oh, okay.
So now I'm also
you're now the only doctor that has not been to medical school. Yes.
So
exactly.
Thank you so much. And this is a very good one. It has actually brought a lot of things to bear. Subsequently, we would try and delve into one of them, particularly HIV.
And the Hep B. Now you know how severe it is.
Yes, and Hep B, because of the rating you just give to us.
The complications. There is a lot happening. Like I'm saying to my yes, there's a lot happening that you don't know that is happening. People are keeping and suffering and smiling. They are covering things. Yeah. For HIV now we've gone far ahead.
We've gone far ahead.
Yeah, now it's like malaria. It's nothing.
No, okay.
Yeah, but Hep B is currently becoming a problem.
Oh, okay. Yeah. Viewers, you've heard it all, and so you have to be careful when you are taking that partner. Even if you want to take a partner, I'll advise that we said that in our very first episode. Try get yourself checked at the hospital. Know your status. whether it is HIV, whether it is a viral infection, maybe hepatitis or whatever. Know your status and take very good care of yourself. You know, as I said, people say that sex is the cheapest commodity. If it is cheap, then you must know it has an expensive side. So stay safe, get yourself protected anytime you're going to have sex. When you're having a partner, you're married, be faithful to your partner. And the best of them all is abstinence. See you another time. My name is PIUS. Bye.